What is evidence-based treatment for ankylosing spondylitis?
Well, evidence-based treatment means that those are the treatments that we recommend, or the medications that we recommend, based on studies that have carefully evaluated the effects of those treatments and have shown that they do make a difference. So we have treatments in AS that have been shown to really improve the symptoms, improve the quality of life, and prevent the long-term progression of the disease.
What is the role of anti-inflammatories to treat the symptoms of ankylosing spondylitis?
If we're talking about the spine, anti-inflammatories are they're our key first-line treatment. Anti-inflammatories are very effective at reducing the pain in the spine when the pain is due to inflammation. And they're our first go-to. And if a disease is well controlled with anti-inflammatories, so patients have little to no pain and it doesn't interfere with their daily activities and it doesn't wake them up at night, then that might be sufficient treatment for them, and they be very well controlled with anti-inflammatories alone. When we're talking about the arthritis in the peripheral joints, so in the small joints of the hands, the shoulders, the knees, then anti-inflammatories' role is really just to control symptoms. So it reduces the pain, but it does not prevent the damage to the joints, and it doesn't affect the progression of the disease.
When are medications other than anti-inflammatories needed to treat ankylosing spondylitis?
So it depends for which manifestations of ankylosing spondylitis. So for the spine, if patients are not well controlled with their anti-inflammatories, so if they have ongoing pain that prevents them from doing their daily activities, if they're woken up at night or the pain is not well controlled, or if anti-inflammatories are contraindicated or that they don't tolerate them, then we move to biologic agents. Because those have been shown are very effective at controlling the pain and have been shown to prevent the progression in the spine. For the joints, if like the peripheral joints I'm talking about, then if the anti-inflammatories there only serve as a symptom control, it's very important to also use the disease-modifying agents, so medications like methotrexate or sulfasalazine, because they prevent the damage to the joints and the progression of the disease. And then if those don't control the peripheral joints, then we would move to a biologic agent or a synthetic targeted disease-modifying agent.
What's the most important thing for patients to know about the side effects of their treatments?
They can be very scary, the side effects, but people have to realize that the disease has side effects as well. So, when we prescribe a medication, it's because the effects of the disease outweigh the potential side effects of the medication. So those are the things that they need to keep in perspective when they're thinking about their side effects and their medication. With monitoring, so if people get their blood tests done regularly, then we are able to pick up those side effects. So there's no hidden damage that we don't see for the most part. And it's also mostly reversible. So that if we stop the medication or reduce it, the side effects will go away.
What non-medication treatment is considered particularly important for ankylosing spondylitis?
Probably the most important non-medical treatment is a physiotherapy and a regular exercise program. And it's particularly important in ankylosing spondylitis because that's how people will retain their mobility. And just generally being physically active and moving actually also is very effective at reducing pain and stiffness that is due to inflammation.
How do you measure the effects of a treatment plan for a patient?
Well, really the most important way to assess effectiveness of a treatment plan is a patient's symptom, especially in ankylosing spondylitis, where for the spine particularly, it's really all about the pain. So what we look at over time is how well controlled is the pain, Does it interfere with sleep? Is the stiffness well controlled? We'll also look at the laboratory markers of inflammation. So we do want to see a SED rate or a CRP that is within the normal range, even if the pain is well controlled, because we worry about the effects of ongoing inflammation. And then the other aspect is we want to make sure that there's no progression on the x-ray. So we will follow radiographic progression to make sure it's not progressing either in the spine or in the peripheral joints. Make sure there's no damage to the joints.